Hi, I'm Caitlin. I'm a physician assistant and I'm in charge of the medical and cosmetic branch. Today I'm going to talk about one of my favorite cosmetic treatments, Botox. Many people are familiar with Botox, but they don't know everything involved in a Botox treatment. So my goal is to give a little information, debunk a couple myths, and make everyone feel comfortable with what to expect if they come in for a Botox treatment. So first of all, what is Botox? Botox is a type of neurotoxin that inhibits the muscle movement. In doing so, it helps smooth out wrinkles and prevent more wrinkles from forming. Botox can be used for cosmetic purposes, as well as medical purposes such as hyperhidrosis or excessive sweating of the underarms. I love Botox for many reasons. One reason is the duality of the treatment. Botox is great because it treats the fine lines and wrinkles people have, as well as prevents them from forming in the future. So people who do regular Botox treatments not only treat the fine lines and wrinkles they have, but prevent them from creating even deeper creases or more creases in the future. The entire Botox treatment only takes a couple minutes, and most people can do it in the middle of the day, on their lunch break, and then go back to their normal routine or their work day. So it's not something people need to spend a lot of time fitting into their schedule. It's relatively quick and easy. What I really want patients to understand is there is a treatment range with Botox that falls between a very light treatment where people still retain a lot of their movement and what's considered a stronger or heavier treatment where patients are quote unquote pretty frozen. Most patients want to lie somewhere in between there. And with Botox, we're able to titrate treatment so we can still create an improvement in the skin texture and a smoothing of the wrinkles without taking away complete movement. When patients come in for Botox, it starts with a small discussion about what the patient knows about Botox, what they've heard, and then I spend a little time educating patients on Botox, whether they're a candidate, the areas we use it, what to expect during treatment. If it's decided the patient's a good candidate, then we can do Botox that day. We start the treatment by marking out the treatment area, performing the Botox injections themselves, which take only 1 to 2 minutes, and then the patient is free to go. There is no true downtime. There is a little redness or swelling that can happen at the injection sites, but for the majority of patients that goes away within 10 to 15 minutes. On the rare occasion that there's a small pinpoint or injection bruise, it can be covered with cosmetics. Things to do to help avoid bruising are take arnica a couple days before your appointment, avoid blood thinners like aspirin, ibuprofen, vitamin E, and refrain from really vigorous exercise the day of your appointment. After your appointment, we also recommend avoiding blood thinners for 24 hours and avoiding exercise for the rest of the day. That depends on the treatment areas and the dosing we're using. In general, most people are coming back for cosmetic facial Botox treatments every 3 to 4 months. If we're treating Botox in the underarms for hyperhidrosis or in the masseters for facial slimming, those patients usually come back every 6 months for treatment. Is Botox painful? This is a question I get a lot. The needles we use for Botox are the smallest on the market. They're in fact insulin needles. Most patients just feel a quick prick, if that, and it's over very quickly. If patients are needle phobic or very worried about this process, we can offer ice and numbing cream to help make the process more comfortable. We can use Botox in many areas. When patients are coming in for facial or cosmetic Botox, the 3 main areas are the glabella, which is the area between the eyebrows, the crow's feet, or the areas around the eyes, and then of course the forehead. Other areas we can treat that are not as common, but often treated, are the areas around the mouth and the chin. Botox can also be used in the neck to smooth the platysma bands and create a tighter appearance of the neck tissue. Another area we use Botox is the underarms. For people who have hyperhidrosis or excessive sweating, Botox can be injected superficially into the underarms to help prevent sweating. A third area we use Botox is the masseter or the chewing muscles. For some patients who have a wider lower face, this can be done strictly for cosmetic reasons to give a thinner or slimmer appearance of the lower face, or for patients who tend to clench or grind their teeth or have some type of TMJ component, oftentimes masseter Botox will help relieve those symptoms. Hopefully this helped answer some of your questions about Botox treatments, but if you have any more questions or are interested in trying Botox, then please reach out to our office. We're happy to schedule you for a consultation.